Good afternoon. Welcome, all of you, to the Mental Health webinar for Seniors Health. We begin by acknowledging the traditional owners of the land. We would like to pay our respects to their elders, past, present, and emerging. On behalf of the chairperson, Vasan Srinivasan, our patron, our board of directors, I would like to welcome you all. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health. It is an important time when the Australian community comes together to raise awareness that mental health matters. Just on a note of that, we have reached out to 10 million Australians, and we've had about 100,000 people join us for our walk, which is a great effort. As part of the National Mental Health Month, the Foundation is organizing mental health forums on important topics. And today, we are here to discuss seniors' mental health. With old age comes a series of challenges, and they experience grief and loss around their independence, working life, and mobility. Though depression and anxiety are common among the wider Australian population, the seniors are more prone to it because these contributing factors, only a small amount of research has focused specifically on older Australians living with mental ill health. Mental health problems are under-identified by healthcare professionals and other older people themselves because of the stigma surrounding these conditions makes people reluctant to seek help. Please join us to celebrate Mental Health Foundation Australia 90 years journey of promoting better health for all.
A journey of 1,000 miles begins with a single step. Mental Health Foundation Australia's journey began 90 years ago. It dawned in 1930 with just a founder and vision, which was to reach and impact Victoria. Now we have a presence in all states and changing lives for over 100,000 people throughout Australia. Our organisation's biggest initiative yet is our National Mental Health Month. Our month-long initiative is to advocate and raise awareness on Australian mental health. Our vision is to recharge and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With the theme being Mental Health Matters, the awareness is cumulative. In 30 events, we have organised to reach the community in all mental health subject matters affecting our lives today. To further continue our journey of 1,000 miles, the Walk for Mental Health has transitioned from a Victoria-only walk to being a nationwide community walk, where anybody from anywhere in Australia can connect with us and walk with us virtually to spread the impact and awareness of mental health. We pride ourselves with making sure all our programs are for the community and are powered by the community. We have a vast growing network of multicultural ambassadors who are part of our program to further the community voice in promoting positive mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to help our fidelity to cope with success during the pandemic, to promote the understanding of unique cultural and ethnic heritage in Australia and the development of culturally responsible and responsive curricula. The Mental Health Foundation of Australia conducted the multicultural research to continue on the development of the fast-growing multicultural fidelity in Australia. With the effects of COVID-19 pandemic, the MHFA has successfully committed the Power Hour of services and the reach to the community. With the helpline hours extended, we are here to show Australians we can be a shoulder to lean on and can be dialed to assist in all mental health matters. Our impact flows into the COVID-19 meal delivery response with the help of the community, local business and our multicultural ambassadors. It has promoted one vision, which is to serve others before self during this time of uncertainty. With over 45,000 meals delivered, we continue to work with the Department of Health, the Human Services, the Salvation Army and the Australian Multicultural Foundation to continue.
I would like to now invite Ms. Carole Crean to give a welcome address. In 2017, Carole became the Secretary of the Mental Health Foundation, Australia, at the amalgamation of the Mental Health Foundation of Australia and the Mental Health Foundation of Victoria. two of the oldest not-for-profit and NGO organizations in mental health sector in Victoria. She was reappointed as the patron of Mental Health Foundation in Australia in 2019. I welcome Ms. Carole Crean to invite all the distinguished guests.
On behalf of the Chairperson, Board of Directors and staff of the Mental Health Foundation, I would like to welcome everyone here today on this virtual mental health forum on seniors' mental health. I too acknowledge the traditional owners of the land on which we are meeting. I pay my respects to their elders, past and present, and the Aboriginal elders of all other communities who may be here today. Well, I didn't really like being asked to be the welcome person for seniors' mental health, but here I am, and yes, I'm part of that cohort. I think COVID-19 has brought the discussions around mental health to the foreground for people experiencing stress and anxiety and isolation. And these, for seniors, these stresses are around anyway, and I'm so pleased if anything comes out of this pandemic, and I think a lot will, that we will start these discussions, it'll be on everyone's mind, and we'll be able to continue these discussions. Besides what was said about the stresses on seniors, the other thing is that the positive factors for mental health for everyone, which include family support, social connection, occupation and exercise, can be absent or diminished for seniors. So there is a big discussion to be held. I'd like to thank everyone for joining us today and extend a very warm welcome to the people who are participating as guest speakers and in the discussion at the end. That is Vice Chairperson for the Mental Health Foundation Australia, Mr. Jim Gooden. Our special guest for today, Mr. Gerard Mansour, Commissioner for Senior Victorians. Ms. Beverley Smith, Executive General Manager, Residential Communities, AIL, Australian Unity. Mr. Chris Reedy, Seniors Festival Director, Department of Health and Human Services. And Mr. Alex Sy, Vice Chair, Mental Health Foundation Australia, Multicultural Ambassadors Program, and all other distinguished guests here participating, listening. Thank you very much.
Thank you so much for that, Carole. I'd like to now introduce Beverley Smith. Beverley is the Executive General Manager of Residential Communities, Independent and Assisted Living. The residential communities business comprises the seniors accommodation developing pipeline, operating 21 retirement living and 7 residential care communities in Victoria and New South Wales. All of these developments are supported by the award-winning Better Together model of care. Ladies and gentlemen, please welcome National Mental Health's major sponsor, Australian Unity's Miss Beverley Smith.
Thank you, Karan, and also Carole for your introduction, and good afternoon, everyone. I too would like to start by acknowledging the traditional owners of the various lands that we're meeting on this afternoon. Here in Melbourne, it's the Wurundjeri people of the Kulin Nation. I pay my respects to their elders past and present. I would also like to offer my condolences to those who have lost family since the beginning of the COVID-19 pandemic, particularly in Victoria. My thoughts and support go out to all of those families for what's been an extraordinary time. I would also like to offer my acknowledgement of the thousands of people in Australia who work in aged care and home care. Those individuals have demonstrated an extraordinary courage and ongoing commitment to our seniors in care. For those who I haven't met, my name is Beverley Smith and I look after the residential communities portfolio for Australian Unity. So as Karan just mentioned, that comprises 21 retirement living villages across New South Wales and Victoria, and also 7 aged care homes. I'd like to acknowledge the very important work of the Mental Health Foundation Australia and acknowledge your profiling of mental health, particularly in the current circumstances with COVID. This is Australian Unity's second year of involvement with the Foundation, and we look forward to tackling some of the most challenging social issues together ongoing. Mental Health Month, held in October each year, gives us an opportunity to raise awareness around mental health and wellbeing, and in particular for seniors. And it's by promoting these activities and ideas that we can actually start to have a positive impact on people's daily lives and the lives of others. Good mental health is vital to our wellbeing, and at Australian Unity, wellbeing is at the heart of everything that we do. 20 years ago, we conceptualised the idea of a national index of wellbeing that could be used to track social progress in Australia. The Australian Unity Wellbeing Index is a joint project between Australian Unity and Deakin University. It measures satisfaction with life across a range of areas, things like the standard of living, health, achievement, personal relationships, safety, community connection, and future security, to produce a holistic view of Australia's wellbeing. The index helps to provide community organisations, government and business decision makers with a credible measure for the purposes of strategic planning and policy making, and to provide everyday Australians with information that they can use to improve their own personal wellbeing. Last year's results from the index showed that the life satisfaction scores of the nation's retirees was actually significantly higher than non-retirees. And it suggests that older adults are enjoying a fulfilling time, and it's generally when life satisfaction tends to peak. And we expect that this is because retirement is a time when people can step back from life's responsibilities a little and start to enjoy more quality time in their lives. And the results suggest that the wellbeing amongst retirees is closely connected to the quality of their relationships and their social interactions with other people. Obviously, wellbeing has taken on a very different frame this year in 2020, and we anticipate that the outbreak of COVID-19 will have long-term and profound impacts on Australia's health and wellbeing, and in particular for seniors. Leading an organisation with 7 aged care homes, I've seen firsthand how this invisible and insidious virus affects the seniors in our community and in our care homes, and the profound impact that it has had and will continue to have on seniors' mental health. Despite the severe economic impact that is being felt by the pandemic, it is perhaps the mental health impact which will be felt for much longer. As Karan mentioned, depression is common in the Australian population, but seniors are actually more likely to experience the contributing factors, such as through physical illness or personal loss. And the mental health of seniors may be impacted by losing the ability to live independently, or the onset of a chronic physical health condition. So within that context then, with the overlay of COVID, we have seen over the last 9 months significant impacts to the mental health of seniors in our care. And if you turn your mind back to almost 12 months ago, which is hard to believe that it's actually been that long, in late November last year, when we in Australia started to hear about the new outbreak, first in Wuhan, but then spreading rapidly across the world. And we started to see the catastrophic impact that it had, particularly on senior members of our community. And in Australia, right from the start, people over the age of 70 were identified as being particularly vulnerable. And the measures that then started to be put into place to support that age cohort. And in particular, in Australian Unity, early in the year, in January and February, we started the planning to understand what the likely implications were going to be across retirement living and aged care. So when Wave 1 actually came across into Australia, you'll recall that predominantly what we were managing at that time was overseas transmission. And the restrictions that were put in place across all of our communities were very much about minimising social contact, or social distancing, as we called it. And particularly for seniors, social isolation becomes a huge issue to that person's mental health, and it actually starts to manifest in their physical health. And we knew that our residents would have that vulnerability. So in retirement living, we very early started commencing programs for virtual connection and how to help people stay connected to their loved ones. And in retirement living, we implemented programs of contacting each of our residents each day, unless they opted out, for a wellbeing check and a conversation about how they were travelling, how they were feeling, were they having regular contact with their loved ones or friends in a safe way. Similarly, in that virtual vein, we entered into an initiative with the University of the Third Age, and Eleni, who is on the call, was obviously instrumental in this initiative. And working with U3A and a small cohort of residents in one of our villages, it was about coaching those residents on how to use technology to connect socially. And we've seen some wonderful results in a relatively short time around a virtual book club, around residents being able to pursue studies online, and that sense of how people are connecting more readily through virtual connection rather than face-to-face, which has been so important. I think we all thought we'd gotten through wave one, and obviously the restrictions started to roll back, and people sort of thought we were on the other side, and was obviously met with great relief. And then in Victoria, early July, we've gone into wave two. And that has obviously been far more intense, particularly in aged care. And I don't think I will ever forget those early days in July where we were watching the numbers of new cases each day just leapfrogging ahead, up until about 725, I think was the peak we got to in new cases in a single day. And in our aged care and retirement living, we were obviously incredibly concerned about the impact for our residents and our employees. And a key part of that was around visitation and how we managed that in a really safe way, with the risk of much higher community or local transmission, and what that might look like in terms of visitors bringing the virus into an aged care home. Our national peak body, the bodies collaborated quite closely in the development of a national code of conduct on visitation, which helped put in consistent and transparent guidelines around how people could visit their loved ones in aged care, and importantly, keep that face-to-face social contact, particularly in circumstances where their loved one may have some behavioural challenges or be palliating and reaching end of life, and how we could still support face-to-face visits through that. For the majority of people, though, it was important to open up channels for virtual visitation. And this is where we've seen such an exponential increase in people's level of familiarity and comfort using different digital channels. So we implemented a large number of iPads into each of our homes, as well as setting up some apps to enable people to have secure face-to-face connection, as well as people using their own devices for things like FaceTime, but making sure that we were actively encouraging families to reach out and make that digital connection, but to call or FaceTime as often as they could to support the social connection with people in aged care while we were under the level 4 restrictions. We also engaged with our corporate staff through that time, and this was through what we call the Better Together Buddies program, which was about us having a corporate buddy, as it were, with those residents who gave permission and opted into the program. And the buddy would call the resident a couple of times a week, had a little bit of background information about the person, their interests, their likes, their sense of humour. And that was a program that we initiated around the middle of July, and many of those relationships are still continuing on, which has just been great to see that, again, social connection, being able to look forward to a chat regularly and help people connected, people feel connected and purposeful in what they're doing. Our CEO, Kevin McCoy, has been very engaged in that program, and it won't surprise a number of you on the call to hear that Kevin's been sharing recipes for gluten-free bread with some of our residents, and has got a great amount of support and goodwill with a number of the residents that he is continuing to call. We also partnered with organisations around bringing some relevant material in for residents in aged care. So with Commissioner Gerard Mansour on the call, and also with the Seniors Festival for the Victorian Seniors Festival Reimagined for 2020, we were able to connect our homes with a lot of that material, which is a great way for our people our residents to feel connected to something that is new and relevant and a bit of fun, and a bit reminiscent of themes that they would have grown up with. We've also had a more serious approach in terms of the role of telehealth in improving mental health outcomes for a lot of our residents, with telehealth consults opening up as well. And I think if there is to be a silver lining around COVID-19, I think it is the way that a lot of health practitioners and consumers have really embraced things like telehealth as a way of connecting in that COVID-safe way, but still making sure that health issues are being addressed in a timely and effective way. Obviously, Mental Health Month is an important opportunity to raise awareness about the impacts of mental health on our seniors and the range of supports that are available that can improve someone's wellbeing. And I'm really committed, along with my colleagues at Australian Unity, to ensure that we continue to develop and innovate new ways for seniors to access and receive effective supports and treatments to alleviate their mental health symptoms. And I think importantly, understanding what some of those triggers or lead indicators can be around social isolation, and being and prioritising that in our endeavours to ensure that we are engaging with people in a number of different ways. We must continue to focus on adapting services and programs that are grounded in evidence and have a long-lasting and meaningful impact on people's mental health. And we look forward to working with the Foundation to identify those service gaps and develop culturally appropriate mental health services for these communities. This is an important and exciting partnership that can add value to what we do as individual organisations. And I thank the Mental Health Foundation Australia for their unwavering commitment to improving better mental health outcomes for all senior Australians. Thank you, Carole.
Thank you so much for that, Beverley. As a mark of appreciation, we'll be posting out one of these engraved pens for you in the mail. Thank you.
Okay, thank you.
I'd like to now introduce Mr. Gerard Mansour, Commissioner for Senior Victorians, to deliver the keynote address. A widely respected and outstanding advocate for the needs of older people, with over 30 years leadership experience within the aged and community services sector, Gerard was appointed as the inaugural Commissioner for Seniors Victoria in 2013. In the words of Minister for Disability, Aging and Careers, Luke Donnellan, Gerard Mansour is an outstanding advocate for senior Victorians, respected, considered and knowledgeable about the issues facing older people. As Commissioner, Gerard provides advice to the government on the needs and interests of senior Victorians, particularly those who are vulnerable, at risk or disadvantaged. Gerard is continuing his work with the Victorian government and Mr. Donnellan to promote the important role that senior Victorians play in the community. Ladies and gentlemen, please welcome Gerard Mansour.
Thank you very much for that lovely welcome and introduction. And I'd also like to start by acknowledging the traditional owners of the many different lands that we're on today. I pay my respects to their elders, past, present, and emerging, and Aboriginal elders of all communities who may be here today with us. I'd like to also join with a few observations as a start about COVID, and then share with you some of the information that I gathered from older people themselves and their carers as I made my submission and have continued discussions with commissioners of our own Victorian Mental Health Royal Commission. If we think about COVID and its impact on the lives of older people, I think we've got to start with an observation and a reflection about the journey of aging. And of course, it's many and different experiences for so many, and I like to think of it as a continuum. On one end of the continuum, of course, older people, senior Victorians, are going to be among the first to re-engage in so many different ways. They'll be chomping at the bit, waiting to travel from metropolitan to regional areas when we can do that. They'll be looking to re-engage with their groups, whether they're involved in a senior citizens club, a university of the third age, a men's shared life activities group, an ethnic specific group. There'll be so many different ways and pursue their life interests, whether that be arts or sport or other things, volunteering in a local community organisation. And so as we think about re-emerging, we've also got to remember that there's lots of older people that are not in that cohort. Early on, we had many messages about the vulnerability of so many of us for COVID, and lots of older people realistically see that there's a risk from COVID, and so they're naturally going to be slow to return to group-based physical presence activities. For others, they've heard a slightly different message. They've heard an overly cautious message where they may not have any particular underlying health conditions. But because we hear so much about people, say, aged over 65 or 70 being vulnerable, they may falsely put perceptions and limitations on themselves that don't necessarily really apply. And so I think when we reflect on COVID and as we move forward and its impact, we need to remember that continuum. Some older people will be amongst the first to re-emerge and re-engage in a whole lot of life activities, and some older people are going to be amongst the last to re-engage. And it's in that category that I'm going to make a few reflections and observations about mental health and mental health challenges in particular. I think, like in any time of challenge, there's been a real community-wide impact, hasn't there? So many of us have had limitations which have necessarily increased our isolation and experience of having a shrinking world to live in for a period of time. But it's brought with it some innovation. Beverley spoke about the wonderful structural reform of the Reimagined Seniors Festival. And for the first time, our ability to have something like that streamed into aged care facilities. And I think that's something that can stay with us. We can think about, oh, here's an enormous opportunity to provide so much artistic and other talent and information to people who live in residential aged care so that they're better connected with our community more widely. And then there's personal innovation as well, isn't there? People that, as older people who may never have connected with Zoom before, that have had an opportunity to open up a whole new world of communication and interaction through technology or through teleconferencing, through medical appointments, etc. For me, on an individual level, one of the biggest impacts for me personally was not being able to see my grandchildren. Like so many, I'm fortunate to have a couple of grandchildren, 3 and 5 years of age. But of course, I found what was interesting, particularly the younger, the 3-year-old, couldn't really connect to this idea of having a video conference. It just didn't work. And after a few minutes, the phone would get flung somewhere as he would go off and do something else. But through the research of my son, we stumbled on a little product called Caribou. And so with this, we could read books together. And on the screen, just like on an iPad screen, we had the book in front of us that we could both read, and a little visual where we could actually talk to and see each other. And we could point to things and highlight things on the pages. And so it's turned from something that we used as a mechanism trying to find a way to communicate, where it's now a structured part of our week, where there's part-time where we can sit down and read a book together. So I think that out of any crisis, there's inevitably some innovations as well. I'd like to also acknowledge the enormous challenges that have existed across Victoria in many residential aged care homes. And on one end of that is, of course, the tragedy and loss. And my thoughts as part of my role, I was asked to provide a supporting role to the Victorian Aged Care Response Centre to assist with some of the discussions and communication with families, and acknowledge the amazing commitment by so many people to get the best possible outcomes in very challenging circumstances. And of course, the media is focused on the tragedy of loss, and my condolences to so many that have lost their lives and so many families affected. But there's been less said about the amazing commitment of so many providers, of frontline staff to turn up every day to do their very best to stop the spread of COVID. And I'd like to acknowledge that commitment as well. But amongst that, of course, we're going to have for some period from a mental health point of view, what I'd call is almost like a delayed grieving process, aren't we? Where so many people either directly or, through secondary or third level relationships know people who have passed away or been affected through the loss in residential aged care. They haven't been able to do the grieving in the family context with life celebration and funeral services in the same way. So I think for some time there's going to be a delayed grieving process, not only from the isolation and adjustments to our own lives, but for the real loss that so many have experienced through the tragedy that came to so many. And so that's some of the toughest end of the experiences. But like I said, in all challenges, there is some light. And for me, I had an opportunity to learn of the wonderful commitment of so many at the front line, but also services like the Australian Centre for Bereavement and Grief, to be in family meetings and hear how some family members talked about how wonderful it was to have a service like that to be able to reach out to, and family members sharing the value that they'd received as individuals from being able to talk through. And so my thanks to people like the Australian Centre for Bereavement and Grief for the frontline support that they've provided to so many older people and family members in particular. But of course, there's a big gap. And many older people continue to be isolated. And I think this is the biggest challenge we have at the moment, is how to find the right balance between an environment in Victoria as our community transmissions, welcomely declining, and we're all getting some excitement and hope as the restrictions ease. But of course, how do we balance that really challenging thing in residential aged care in particular about stopping the spread of COVID by having restricted access, and on the other hand, ensuring that visitors and families and loved ones who provide so much, not only visit, but care and support to people living in residential aged care, how do we get that balance right? And we've still got some way to go from my point of view in that. We've got to continue to look for ways of allowing people that live in residential aged care to have the proper access that they will need to have a quality of life. And I want to acknowledge the challenge with that, but it is all about balance, and we need to make more steps in that regard. As I worked on earlier this year and late last year on my submission to the Mental Health Royal Commission, if I have an opportunity to, I go back to older people themselves, and I organised a workshop and a forum of many older people and carers. And I'd like to share with you some of the thoughts that they gave me around my submission to the Mental Health Royal Commission, because of course, the challenges around mental health that predated COVID are going to continue to be there in so many different ways. That's the world that we're going to move back into. And the first observation I had is that there's a sort of what I'd call an internalized ageism that so many people have as they progress through their journey of aging. And it takes a few different forms at an individual level. Sometimes there's a sense that we can't do the things that we would have done in the past. So we put like a self-limiting valve on ourselves, and we don't see that we can innovate and have opportunities in the same way that we did in the past. That we might not have the same resilience that we had. So there can be this sort of internal constraint that stops people reaching out for support in a timely manner. There's a real fear at times about the loss of independence. And sometimes older people see reaching out for help, not as a way of sustaining them and supporting them, but as actually a period of loss. And so we need to think about mental health and acknowledge mental health often has that same context. The second is sometimes the language is a challenge. We have in Victoria an aged person's mental health system. Well, of course, a lot of baby boomers don't identify as aged persons and be very reluctant to engage in that way. And they also can, and many older people have come through a period of life where they don't necessarily talk about mental health issues and mental health challenges in the same way as our younger and younger adult generations do. And there's something for us all to learn from that. It can be a very freeing thing to acknowledge that mental health issues exist and to talk about them. And so on the one hand, for many older people, there's a real resilience and a toughness of getting on with life. But sometimes that masks an inability to talk openly and acknowledge the challenges of mental health issues. Sometimes as well, our mental health system provides constraints and restrictions on us. Sometimes I hear that there's feedback that GPs and other mental health professionals talk about anxiety and depression as if it was a normal part of the aging process. And of course it's not. And it can lead to approaches where people just are prescribed a bit of medication and there's little else spoken about. And so, for example, with issues of isolation, where there needs to be a discussion about engagement in social participation, activity groups, or have you thought about joining a U3A? Have you thought about a men's shed? That there's a sense that a prescription is the solution rather than looking to the causal nature of what might be the reasons why people are experiencing anxiety and depression. And so we need to be able to call out structural ageism and sense that anxiety and depression is not a normal part of the aging process. And of course, we need to challenge those assumptions head on. And let's reflect on it this way. Let's also think about prevention. Someone who's currently 60 or 65 years of age could easily have 20 or 30 years of quality of life ahead of them. If we're fortunate enough to live long enough, people in their 90s can be extremely healthy and well and able to participate and be volunteers and significant contributors to life. And so even as we think about those early years of aging, 60 to 65, let's make sure that we think about prevention and confront issues like anxiety, depression, isolation, and loneliness as significant issues that we need to name. One of the wonderful things that I learned from my consultations is that so many older people that have mental health issues have amazing support from GPs and health professionals. It was a really mixed bag. Sometimes there was a sense of an under recognition, but at other times people could say to me, I wouldn't be here today if it wasn't for my GP or my health professional. And so I'd like to acknowledge the wonderful contribution by so many people that work in the area of mental health and provide amazing support to so many older people. But the biggest challenge that I see is not so much for people that are within the mental health system. The observation that I have from the feedback that I got is when people are under active treatment, they actually in Victoria get good care. The challenges are more about what happens when they're discharged, what happens for underdiagnosis, the complexity of identifying the interplay between, say, mental health and dementia. There are significant issues that we've still got to address that are more dealt with from the interface issues and a question about whether we've got the right structural nature of the mental health system that we're trying to build. And I'll say something a bit more about that in a minute. The final thing that I learned from my consultations from an individual perspective is that there's still a real stigmatization about older people, not only talking about mental health, but those people that have mental health issues that have been part of the system being willing to talk openly about that and share their experiences. And I have been in forums where, the generosity of people sharing their life experiences and how powerful that is to allow others to talk openly. And I think that's a really important part of the future that we've got to build is people being willing to share those life stories of how they've dealt with challenges and how freeing that can be for others when people are brave and willing to do that. From a systemic point of view, what I learned was that too often the mental health system is fashioned by a lack of resources to a system of engagement and then disengagement because people are discharged. And one of the very common comments I heard from older people and their carers is that we need a system that intervenes earlier in cases. Compared to, say, the youth system, we have an open conversation about prevention and early intervention. We don't have that same focus when we think about the design of the mental health system. And so what they said to me is we need to revision the model across a spectrum of illness. And we need to move away from an episodic nature of we move into a phase of a treatment and move out of a phase of a treatment to have much more of a continuum of care model. And so one of the challenges we confront is that we need to have a system that has different components. And what I learned is that I think in Victoria, just like our Mental Health Commission spoke about in its initial report, we actually have a missing middle for older people. So on the one hand, we've got some early programs. And on the other hand, we've got an aged person system. And I think what we're missing in the middle is a system that's designed essentially around a psychosocial community-based model. A model that allows people to look at multidisciplinary community-based interventions. We've got a wonderful community health system here in Victoria, but we don't leverage that as the basis for a community multidisciplinary model. So I think there's enormous opportunity as we look forward to the final report of the Mental Health Royal Commission to think about how we can move away from the short-term case management type model that tends to be crisis driven to a multidisciplinary ongoing system that has case manager as a central part of its support for older people. And I think as we think of building a system, we can acknowledge the strengths of the current system, that older people, whilst they're in care and support, are very confident that generally they receive good quality care and support. And instead of having a system of discharging, what we move to is a new model of missing middle, so that we don't have a model of care that's based by, I'm waiting till I have my next crisis. I continue to remain connected, continue with the case management model, and waiting for an opportunity when, yes, there is a next crisis, I'm still part of a system. I'm not feeling that I'm artificially unnecessarily discharged and I'm waiting for the next crisis till I reconnect. So there's some of the observations I have about the type of system that I hope the Mental Health Royal Commission is to recommend into the future. Build on the strengths of our current system, acknowledge the amazing commitment and dedication of so many staff and frontline professionals, but build us a system that caters for and provides the missing middle, that's essentially around a psychosocial model that acknowledges the challenge that older people do experience from a mental health point of view and addresses the stigma that can go with that head on. So I think as I look forward to the future, I have a real sense of confidence that yes, we're coming out of a challenge of COVID and the crisis and the isolation that COVID gives us. But I think that there is a sense that I have that I've been in this role now for 6 or 7 years. And a lot of the time I've felt as a commissioner, my challenge is to get older people onto the radar. That was really the work I was doing, is just to get conversations about older people. My sense is the paradigm and the time has shifted. My sense is that there is a recognition that there's been a disproportionate impact of COVID-19 on older people, that ought to flow through to the way we think about mental health and the design of our mental health system, that we can encourage older people themselves individually to be willing to talk more openly about mental health issues. We can continue to encourage GPs and health professionals to recognise that mental health issues are not a normal part of the ageing process, that we need specific and dedicated strategies, that this is the time to think about innovation and to support older people themselves and their carers and their families, to acknowledge that as part of the ageing process, there are times where many older people will experience mental health issues. And so let's build and fashion a mental health system that supports older people and all of us as we move through that journey of aging, that if we're lucky enough to live long enough, many of us can make an enormously powerful, positive contribution to life, but we're also licensed to experience our own life challenges along that journey. Thank you for the opportunity to share my learnings and my experiences with you today.
Thank you so much for that, Gerard. We will be sending out one of these engraved pens for you too in the mail. Thank you so much for your time today. Next, we have a recorded message from Mr. Alex Sai, Vice Chairman of the Australian Multicultural Ambassadors Program. Alex is an experienced general manager, CEO from various companies with strength in leadership and transformational changes. He is involved with various multicultural groups, as well as community groups, and a part of the State Government Multicultural Engagement Committee. He is currently the Vice President of the Life Activity Club of Victoria, helping people over 60 years old to avoid social isolation. He is the current Board Director and Vice President of the Australian Philippines Business Council, connecting companies doing business in the Philippines and Victoria, and is active within the Filipino community and founding President of the Cebuano Association of Australia. Let's hear it from Mr. Alex Sai.
Hello, everyone. I'm so humbled to have been invited as one of your speakers at today's forum. It is a subject which is very close to my heart. My name is Alex C, and currently I'm a multicultural ambassador for the Mental Health Foundation Australia. At the same time, I'm the vice chair of the Multicultural Ambassadors Program. I also volunteer and currently is the vice president of the Life Activity Clubs of Victoria. It is a club which was established in 1972, and now we have over 5,000 members with 20 clubs spread across Melbourne and in some regional country, Victoria. The focus is for our members to experience stronger social and community connections and reduce social isolation. And they'll be able to manage their transition from employment towards retirement. So it's an organization and a club mainly for the seniors. And the key outcomes are that our members enjoy improved health and well-being, which will contribute to a longer life. Each of our clubs conduct social activities for their members and invite non-members as their guests for various activities. And each of these activities forms a group that is dependent on the members' interest. And some of these activities can range from walking, cycling, playing cards, playing mahjong, dancing, dining, reading books, having tours, and so forth. So since COVID, all these physical activities and social connections have stopped. More than ever, our members are battling mental health challenges due to the lack of physical and social connections, which they experience in a club environment. However, just to share with you how some of our members are coping through the COVID lockdown. It's very hard because some of our members live alone and some of our members have no social interaction as well. But the clubs have been so proactive. They have what they call phone call bubbles, whereby the clubs are actually ringing the members to ensure that they are okay, to make sure that they remain socially connected to the club. At the same time, the Life Activity Clubs board have been funding to have Zoom available to every clubs. And also we have initiated an online trivia via Zoom, and it creates a social environment such as like inter-club activities. And some of the clubs have been sharing some of the activities they've been doing through COVID. And some of them have in-house playing cards. They do their daily walks, and some of the members of these clubs live close by. So they stop and have a chat outside their place in a COVID-safe way. And our members and the clubs have embraced Zoom in a bigger way, more than what we have imagined. And now they're introducing activities with their members virtually via Zoom. Such activities are having tasting nights, whereby via Zoom they have wine and cheese tasting. And they have reading clubs. Some members established a reading club via Zoom. So it's really good in a way that the clubs have engaged back to the members to ensure they remain socially connected. And funding doesn't come easy. So that's why we from the board perspective, we always encourage funding from the government or the Mental Health Foundation in itself to ensure that we can help our clubs to help the members to remain socially connected. And there's no doubt some members have dropped off because of lack of connection, and also they can't afford the fees. So extra funding will help re-engage these members who have dropped off back to the club to ensure they remain socially connected. Now more than ever, it is so important that we continue what we are doing to ensure our members remain socially connected and avoid social isolation. I am so honored to be part of this organization. My relationship with the Mental Health Foundation Australia has great meaning and connection together with Life Activity Clubs of Victoria, where I can share information and resource material from the Mental Health Foundation Library to the members of Life Activity Clubs. And by having such a great forum such as this to share one's experiences and to learn more about how we cope with COVID and prevent social isolation. Once again, thank you so much for allowing me to be one of the speakers at this forum, and I encourage you to look us up and see what we do as a club under Life Activity Clubs Victoria. Thank you once again, and my name is Alex C.
Thank you so much for that, Alex. Now it's time to move on for the panel discussion today. And we have Mr. Jim Gooden with us, who will be moderating the panel. Jim is now the Vice Chairperson of the Mental Health Foundation Australia. He is a former Vice Principal with 30 years experience in regular secondary and special needs schools. Currently the President of the Mental Health Foundation of Australia and Co-Chair of the Victorian Mental Health Monthly Advisory Committee. Jim is also committee member on many other boards and committees, including the Royal Australian and New Zealand College of Psychiatrists, Chisholm Institute Course Advisory Committee, and the Melbourne Bipolar Network. Jim was also the former Vice President of the Australian National Association for Mental Health and former President and Secretary of the OCD. Jim's knowledge of mental illness comes from professional, voluntary, and family experience. We also welcome back Mr. Gerard Mansour, Commissioner for Seniors Victoria, and Ms. Beverley Smith, Executive General Manager, Residential Communities, Australian Unity. Along with that, we also have Mr. Chris Ridey, Manager, Victorian Senior Festival, Senior Card Operations, Seniors Aging and Carers Branch, Department of Health and Human Services. Since 2008, Chris has been employed by DHSS as the manager of the Victorian Seniors Festival, responsible for creating and project management of this annual statewide event running throughout October. It is through that work that he has learned from and established partnerships with a host of community-based organizations, including the Mental Health Foundation. Prior to joining DHSS, Chris was a freelance festival and event producer. He entered this field of work following his graduation from La Trobe University, and through his work in the community sector at VCOSS and his various community art roles at Victorian councils. Chris has 4 adult children and normally enjoys Melbourne, rich cultural, sporting, and community life. He is currently living in and working from Janjak and feels blessed that he has been able to do this during this period of enforced physical isolation, as the ocean has always been his go-to place when seeking calm and stillness. So if he looks more tan than us, we know why. He's been at the ocean. Over to you, Jim. Thank you.
Thank you very much, Karan, and congratulations on your skilled emceeing of this event. I too would like to acknowledge the traditional custodians of the land and the elders, past, present, and emerging. I also recognise that this land has been inhabited for countless millennia and never ceded by the original inhabitants. Welcome to our panel, Beverley, Chris, and Gerard, and let's begin. I came across an interesting quote by American feminist writer Betty Friedan. She said, "Aging is not lost youth, but a new stage of opportunity and strength." Yet in today's society, we are inundated with anti-aging products, surrounded by media promoting youth and excess, and constantly told that we need to look younger. In all this, it's easy to sometimes forget the value of age. I'm sorry, I just lost my notes there. it's easy to forget the value of age. Things such as wisdom, the priceless value of experience, and the beauty of maturity all accompany the aging process. But unfortunately, as it's been indicated by particularly Gerard's talk, unfortunately not for all. Aging can be physically, financially difficult and a lonely time. Open question, which cohorts of older people are in the most mental distress in our community at the moment? I know to some extent this has been addressed by the discussion of the COVID-19 pandemic, but in terms of frailty, physical issues, etc., loneliness, which groups in particular? Would anyone like to discuss that or begin the discussion of that?
I'm happy to bat off if you want, Jim.
Please, Gerard.
Two groups come to my mind as the most vulnerable. I think there's a number of people living in their own homes who, because of concern of catching COVID, have either significantly cut back or stopped their home care package visitations. And so they're not receiving the care that they should receive because of fear, and that they haven't been able to accept that the adaptation, say, by providers and change practices hasn't met their fear requirements. So that's definitely on my mind. How can we encourage those people that there's been a lot of time and effort put into thinking about how to safely deliver services to people in their own homes? So there's a group in that category. At the other end, I'd say absolutely residential aged care. There's still a number of older people that are living in residential aged care homes that have had COVID, who still haven't yet had the opportunity to return back to their normal life. A lot of the structural change that providers have been forced to do is to move people within their aged care home, and maybe a lot of people don't understand the practical implications, but they've had to separate people into sections of a home into non-COVID and a COVID positive and negative space, Jim. Now, what that means is a lot of people haven't even got back to their own room yet. And so we've still got quite a bit of dislocation. It's gradually changing, but that's another group that's definitely on my mind, is the support we need for people who are living in residential aged care homes.
Beverley, do you have anything to add to that?
I would completely agree with that. I think, certainly from a practical perspective, we have seen quite significant cancellation of services in home care across both our Victorian and New South Wales footprint. So there is a level of fear for people in the community. And exactly as Gerard said, it's about how we help people to understand all of the measures that are now in place. The single-use masks, etc., that have been built into the practice to keep those consumers safe. In residential aged care, similarly, I think certainly providers are on a continuum in terms of their level of preparation, and in particular in Victoria, what many providers have gone through in terms of outbreaks. So I think that is still being worked through. And I think until such time as we have a vaccine, I think the older population will naturally still feel very vulnerable from this virus, because the consequence is so different for a senior person as against somebody who might be much younger. So I think that there is still a lot of fear sitting behind the decision making for most consumers.
Chris, any thoughts?
Look, I think there are two particular groups that I think about. Firstly, as has been mentioned, those who are socially isolated, geographically and socially isolated. And I also think for those living in uncertain conditions, for example, there's an increasing number of older women facing homelessness. I just think that those facing economic duress, that can lead to so many poor outcomes for people. And I think there's been a focus on this during the COVID period, which is a really good learning for many of us. And I think we need to continue to understand that the basic principles of housing and shelter and so on are so important.
Thank you. Beverley, I'm going to throw you a real can of worms now. My father's greatest fear was not being able to live independently as he grew older. Now, Commissioners Richard Tracy and Linnell Briggs from the Royal Commission to Aged Care Quality and Safety have described the aged care system as a shocking tale of neglect. Clearly, there are enormous mental health implications. What needs to be done?
Wow, I think that that's worthy of a sort of session in itself. But I think,
It is indeed.
you know,
I told you it
what
was
I
a
take
can of
great
worms.
what I take great comfort from is I think that the Royal Commission has been quite exhaustive in its ventilation of the issues in the sector, that they have looked at all components in terms of the provider's perspective, what the regulations look like, what the funding looks like, the governance and quality. They've acquitted themselves in terms of international models, what's working, what's not working. So I do think that the recommendations that are being formed up are likely to be very comprehensive in terms of what needs to change. And they have made it very clear that this isn't a tinkering at the edges, that this is wholesale reform. The question, I think, will then come back to what level of those recommendations are then adopted by government and the extent to which the reform is funded. You will have seen that the quantum of uplift that has been identified is quite significant in terms of ensuring that we have a significant uplift in the skills, the training, the remuneration for people working in aged care critically, and in terms of access to services across regional, rural and remote. So I do think that the recommendations will be very constructive, but there is still a significant question mark on the level of funding required to truly reform the system for across home care and residential care.
Is a sufficient emphasis and on elderly people or aging people staying not only in their own home but perhaps with families? It's not something in Western culture that's we're particularly strong in advocating. I know my experiences with my elderly parents was that it was positively scorned by the local council. They really felt that my parents should be in aged care, where I was determined to try and look after them at home. And I felt that there was quite a bit of opposition to my doing that. Is that something that we really need to address more vigorously in our community?
I believe so, and I think that there are recommendations and themes coming through from the Royal Commission that have looked at that. They've looked at improving the flexibility for carers' leave and supporting people to care for their own family, whereas currently you might qualify for maternity leave, for example, but the same constructs and financial support aren't yet available if you were caring for an elderly parent. So that theme has certainly been looked at through the Royal Commission. Similarly, changing some of the building codes and also the regulations around being able to, create the sort of granny flat concept in your own home, I think are also being looked at in terms of how that might be more accessible for people. So on the accommodation side then and on the sort of support services and financial side. So I do believe that has progressed. With all of this, is it moving fast enough? Is it going to sort of if it sits purely with the Department of Health in terms of funding, are we going to get the speed of change that I think the community is looking for? That's a question mark for me. But I think the Royal Commission has commissioned some primary research from Flinders University around the community's expectation of these changes, the community's expectation of funding levels and what types of services are funded. And I think that, again, gives a great insight in terms of what we as consumers and the community are looking for and expecting in different supports for ageing parents and ageing members of our community.
You mentioned the qualifications, of course, that our carers for our aged community have. And I noticed just today in my inbox from the Australian Institute of Health and Welfare, figures received today show that 64% of residents require special care for cognitive and behavioural issues. Do you think our staff are sufficiently trained to deal with these sorts of complex issues? And Gerard has alluded to some of them, of course.
Absolutely. Look, I think it's well recognised that the qualifications and educational support for our people certainly needs to improve. And at Australian Unity, we are very passionate about workforce and what are the right capabilities, the right training and experience, but also the right long-term job and career pathways for people. So, for example, we have internal targets around the number of our employees who will be on permanent contracts, not casual. We prefer not to encourage the casualisation of the workforce. And it's about how we're offering opportunities for learning and development on the job, as well as further educational qualifications for our team members. The role of people in care is fundamental. It is the most important thing to get right. And the relationship that our team members have with residents in a community and aged care setting is what we would say is our number one non-negotiable. So it is something that we're working consistently and constantly towards improving.
Right, now I'd like to put a general question to all three of you, and this is a question that was asked by Naomi, who I notice is in our virtual audience today, and I will read the question. The stigma of ageism includes negative attitudes, stereotypes and behaviours towards older adults based solely on their perceived age. In other words, as people get older, others assume that they are increasingly susceptible to mental or physical impairments that make them no longer able to contribute in a way they once were, decreasing their value to the community. Taking away someone's right to be of value and feel valued has a huge impact on a person's mental health at whatever age. Is the pendulum swinging positively or negatively in this regard in relation to older people? In other words, is our appreciation of the elderly's need to be of value and feel valued improving or decreasing across the community? And I will lead into another question with this. Who'd like to have a go at that one?
I'm happy to comment on that, Jim. I'll very shortly be publishing another report. As part of my work with Minister Denell, we identify key issues that I want to take to older people, get their feedback on, and then publish a report. And that's going to be about what it means to age well. Now, as part of that report, when I talk to older people about the challenges of growing older, one of the most common words they use was the word invisible. There's a sense that as you get older, you become invisible to the community and the community around you. Now, I did that research in October, November last year. My sense is, and I've, a bit more upbeat, I think there's been a shift in our community. I think that the whole experience of the vulnerability of older people living in residential aged care, and not just from a tragedy point of view and the cases that led to the Royal Commission, but from a much more sense of, well, we need to protect and recognise that we've got a whole lot of people who live in residential aged care and we need to think about them. And so I have a more positive, upbeat look as I think about next year's Royal Commission. I think there's going to be a real expectation from our Australian community that we move to a better system. Now, that's one part of it. I don't think we've necessarily moved on the invisibility question around the value of older people. I think there's a lot more work to do there. But I think on the respect side, that we need a system to acknowledge the contribution of older people. And as we think about the design of the aged care system, I'm more positive than I was before that the community itself is going to hold the government to account in its response to the Royal Commission in a way that we wouldn't have maybe a year ago.
I think that's exactly right.
Beverley, please.
It really, I think that that a number of those topics have really come to the fore as a result of COVID, and not only in Australia, across the globe. We've seen some really ethical dilemmas around the access of older people to hospitals during COVID outbreaks. There has been a lot of media across Australia around that and a rights-based approach to ageing. So I think I share Gerard's optimism in terms of I think that there has been a shift and that people are now collectively much more conscious about those biases and those ageist views that have been so embedded, but now people seem to really be calling them to the fore in terms of, well, you know, what rights do older people have in terms of their access to hospital, and what rights do older people have in terms of their access to the health system in general, to other services, etc. I'm always somewhat bemused by the fact that once people reach around the age of 65, everything that kind of happens to you post the age of 65 is viewed as one sort of segment in the market. It can be a period of 25 to 30 years of someone's
Yes.
life, and their needs
Yes.
and expectations and what they aspire to through that time will change dramatically in that 30-year period. And yet we've pretty much just lumped it into one homogenous block. So I'm very much looking forward to how we start to better understand that third of people's lives and start to really see that as an economically productive, socially productive time of people's lives, where their contribution is as meaningful and purposeful as it has been in the prior 65 years.
Chris?
Well, I think that Naomi's right. I think that feeling that you're valued is such an essential element of well-being. And I think that many of us have understood that right through our lives, and it doesn't disappear, that need to be valued and needed. And I think there is a sense of willingness at a community level and an institutional level that be better understood and recognised that and I think the pendulum is swinging towards a more positive, respectful understanding of the place of older people in our community. I do.
And Chris, can I just jump in there and say that
Please,
one of the ways the pendulum is swinging is by acknowledging the contribution of seniors themselves, and that brings me to you. I wanted to pass on my congratulations, Chris, to your award, because you've received a wonderful award and acknowledgement for your contribution. So I think that's an important part of it as well, Jim, is celebrating the contribution and achievement of people like Chris.
Oh,
Look,
I completely agree.
The festival has become a great vehicle to provide a platform to show the world, to show older people themselves and what other older people are doing, and to celebrate and witness the joy that we all have around that, but to also reinforce to other audiences, whether it's a government audience or a younger audience, what older people are doing. There's another interesting question that's come through, Gerard, around end of life and people feeling concerned about not being able to have their wishes at end of life fulfilled. Do you think that has a big impact on people's sense of well-being as they grow older?
Yeah, look, I think it's one of the challenges. We've done a lot of work in that space where we've been able to identify that often it starts with an older person themselves being willing to have the conversations with family and friends about what those wishes are. Sometimes, and I'm sure Beverley would have experienced this, sometimes in residential aged care, there's almost like a bit of a battle that happens within a family. But often the battle is because people have really genuinely different views about what it is that mum or dad or their partner actually wants. And so I think part of it starts with each of us, Chris, around what are our own wishes? Have we taken the time to talk about them and share them? Have we documented them? And so I think, the beginning is actually there. And then once that's done, I think we're getting better at having the systems in place to document that, to have it provided to whether it's a health professional, a GP, but often the starting point is, have we thought about that ourselves? What if we get to the point where we need assistance and we can't make decisions for ourselves? Have we empowered the decision makers with knowledge about what we want? And so I think we're getting much better at understanding the importance of that.
Thanks, Jim, for allowing me to ask that question.
No. Well, one of the questions I was going to ask, of course, was you've managed the Victorian Seniors Festival for many years, and the Mental Health Foundation's been fortunate enough to be part of that. And I was going to ask what the chief aims and achievement of the festivals have been, but I link that in very much with what Gerard and Beverley have spoken about. It has made elderly people less invisible. It's given them a role, it's given them outlets to use their energies, it's given them pursuits, ideas, etc. and I think it's been a marvellous achievement. So I'll just answer that question for you.
You have.
Yep. Sorry, I tend to
that's good.
talk too much.
No, that's good. That's good.
One thing that has concerned me has been the attitude, I think, towards by some people in the community in relation to this COVID-19 pandemic. That I don't want to gild the lily too much. But there was earlier on a sense of, well, you know, we're losing people in aged care. We're losing, you know, elderly people who probably haven't got long to go anyway. This was. I got the feeling that it was almost an acceptable loss, or viewed as such by some people in the community. Do any of you have any views about that?
Well, I think in terms of people's mental well-being, I think it's been really good and important that the pushback to that has emerged very clearly, and the valuing of people's lives has become to the forefront. And I think in terms of mental health, that's been very refreshing for older people to hear. That's part of what I'm saying about, I think the pendulum is swinging, that people do respect that you live your life to its full. Yes.
Gerard, you mentioned that those years after the age of 65, we might expect to live another 20 years according to the statistics. And there are all sorts of avenues, activities that are open to us. You also, in your writing, said, let's put to bed the myth that you can't teach an old dog new tricks. And work is often a new trick for many people. I believe the statistics are that 1 in 8 seniors are currently studying or trying to advance their careers in some respect. Certainly government is looking at increasing pensionable age, and that's going up all the time. So there seems to be a realization that the elderly will in the future, or older people will in the future, become increasingly more productive. How realistic do you think this is? Do you think it's driven by an altruism, or do you think it's more driven by a kind of an economic realization of the cost of caring for our elderly with pensions and welfare, etc.?
Maybe it's driven by the reality that we're just starting to come to terms with what the aging of the population, we've used that term a lot, haven't we? The population's aging. But I think we're just starting to understand what that means, that, you know, someone at the age of, say, 60, if you look at the data from the Australian Institute of Health and Welfare, now they can have at least 15 years, maybe longer, maybe 20. Well, they'll continue to have the opportunity to do in life everything they've already been doing. You know, it's not a small period. And so I think as that door opens up, people are thinking about reimagining what's possible. They're looking for ways to innovate. You know, I've had community meetings where someone at the age of 82, I can remember this lovely Turkish lady that got up and shared her background and said she was from Turkey, and that, you know, for her, the real gap was communicating with her own family. But her granddaughter had taught her how to use Facebook. And the lady next to her stood up and she said, well, because at 82 she learned how to use Facebook, I thought, well, I can do it too. And so I think part of it's around removing the, you know, that internalized ageism, that sometimes is a personal barrier, but also recognizing, you know, when I look at community groups, for example, and we look at and ask ourselves who are on our local committees of management, they're often dominated by older people. And so I think it's that combination of each of us having an aspiration that actually life can create different things and opportunities as we age, and the fact that those opportunities are increasingly there for us. I think that it is all about reimagining what it's like to grow older.
Beverley or Chris?
Look, I think, Jim, I completely agree. You know, often traditionally we've sort of looked at this time as people age as one of kind of burden and deficit. And I think, you know, when you actually understand that people still have aspirations, they still want to feel purposeful and productive, right to the day that they draw their last breath. I think that we will start to see different types of employment opening up for people. You know, we all know of lots of stories of people who retired and then kind of came back out of retirement, either volunteering or going back into paid employment. What work might look like for one of those people won't necessarily be a 5-day full-time role, but I think as a community and as an economy, we need to explore kind of that longevity benefit. You know, if people are staying healthier for longer and want to stay purposeful and productive in their community, then what does that look like? And how do we rethink how work is shaped? How do we rethink volunteering and community benefit? Because it's like that Maslow's hierarchy. You know, we've always thought about it in the bottom couple of layers in terms of food and shelter, but really people still have a lot of aspiration in terms of hopes and dreams, traveling, further education, continuing to grow and develop as a person. So I think we will absolutely see that open up and be far more accessible to people. And to Gerard's point, I think it's those role models that we need of people sort of setting the example that says, hey, at 82, it's okay to learn how to use Facebook. You know, we've all got examples of people kind of pushing the stereotypes as we've historically known them. So it's about getting those really meaningful role models, I think, more visible across our community. You know, Dame Judi Dench, the oldest person on the front cover of Vogue. I mean, what a wonderful example that is.
Yeah, and I think also
Helen Mirren.
Helen
Yes,
Mirren.
sorry, please, Chris.
Another great favourite.
I think also, Jim, and all respect to Mental Health Foundation, because I think the fact that people of all ages now, it's being led by younger people, but people of all ages feel more comfortable talking about their mental health and well-being, and that whole discussion can be enlarged to include what people are capable of doing, what they want to do, and what they need to be able to do something. Just as we're thinking about, well, you know, working from home, there's a whole cohort now working out how they may work from home. That voice is being heard. I think the general overall discussion about mental well-being will assist an impact on the older cohort too, around people wanting to listen to what it truly is they want. I think the listening bit, I think we've become far better listeners this year. And I think that's going to have great impact across a whole range of things.
It strikes me that the years from 65 onwards, of course, rapid years of physical and mental change. And I can't help but think that there is some kind of similarity between adolescence and, you know, the tremendous changes that occur during adolescence. Of course, adolescence is a focus of mental health change and improvement. Is it? Sorry, there's just another phone going off at the moment.
I think Jim's just muted himself there.
Yes, he might have.
But to answer, Jim, I don't think it's the same as adolescence, but I think it's as important as adolescence. And that's not just because I'm 66. I do think that the idea that we can speak about and aim for and aspire to and seek support to be able to live a rich, interesting life into our 60s, 70s, 80s and 90s is a really great aspiration for communities to have. And I guess I don't want to appear too much of a glass half full, but I am optimistic that the younger generations have led the way for us to better understand what is really important in life. And I look forward to supporting them in all their climate change endeavours. That'll keep me busy until I'm 90.
Thank you so much to all the panelists here, Jim, Gerard Mansour, Beverley Smith, and Chris Riley. Very informative session. Unfortunately, the time constraints do not allow us to go any further. We have to close this, but we'd love to pick up from here and go further some other day. Would like to invite Jim Gorin to come in and do the vote of thanks on behalf of the Mental Health Foundation. And Jim, we are eagerly looking forward to seeing you back here in Victoria after you've done your mandatory 14 days of quarantine in a resort, whatever it is. So welcome back soon. And over to you, Jim. Please do the vote of thanks. Thank you.
Thank you very much, Karen. I hope I don't have to do that 14 days, but we'll wait and see. Look, first of all, Karen, I'd like to thank you very much for your excellent emceeing and hosting of this event. I think it's been exemplary, and you're always willing to help in so many ways. I also want to mention that Karen has been a major influence in getting out those 45,000 meals that the Mental Health Foundation has produced for the needy in our community. A lot of them have actually gone to the elderly in our community. I'd like to thank Carole Crean, our patron. I'd certainly like to thank our panelists, Gerard, Chris, and Beverley. And it's been wonderful to have a discussion with you. I wish it could go on for longer. I have a lot more questions. And I just think your expertise in this area is so outstanding, obviously. I wish I could bottle it somehow and we could distribute it amongst the community and everybody could have the benefit of it. So thank you so much for your addresses and your contribution and your ongoing contribution, I must add. Also to Mr. Alex Sy, thank you very much for your address. We didn't get onto the multicultural community aspects because we ran out of time, but of course that was another area, because 1 in 3 of our multicultural, 1 in 3 of our residents in aged care at the moment come from non-English speaking backgrounds, which is a huge issue. I'd also like to thank all our patrons, directors, staff, volunteers, and especially the attendees who joined us today. An enormous vote of thanks to you all. And I'll pass back to you now, Karan.
Thank you so much for that, Jim. And thank you, as Jim said, to all of you for joining us today. We look forward to bringing you more and more of these informative sessions going forward. All of you, stay safe, stay blessed. We'll talk to you soon. Thank you. God bless.